I'm Julia. I'm a craniosacral facial therapist and I work a lot with very small babies and young children. And we'd like to talk about the sense of touch. It's such a critical part of a person's healthy development. The nature of the treatment is that I am going to touch the child. I touch the child through the clothes. There's no undressing at all. My touch is extremely light. It's about leaning into the fascia, the connective tissue of the body, and feeling what is needed. And I always follow the tension that the baby is ready to release. I don't impose any techniques. I do not impose any kind of force on the child. I sometimes see parents are worried that it's too gentle and too light, and they'll say, just really get into the tension. And that's not at all what I'm here to do. I'm here to say to the nervous system that's running through that body, it's okay, this is safe. That trauma that you picked up during the birth, or that terrible squashed feeling you had in the womb, it's time to let it go. And the tissues can start to free that up through a gentle touch only. So there's no force from me in the treatment. Sometimes the baby will have a moment where it prefers a firmer touch. I will follow that and stop that immediately they've had enough. A different aspect of the sense of touch in my work is observing how a child experiences their sense of touch. If they find their clothing, the surface of the table, extremely distressing, if they're fidgeting and wriggling and can never come to rest just from the textures around them, that speaks to disorganization in the brain around the sense of touch. And there's a whole protocol we can follow, and that's how the therapeutic aspect of the sense of touch is very important. How does the child experience sense of touch? Renelle, tell us from your point of view.
So we at the International Association of Infant Massage always encourage parents to keep the touch positive. In fact, we sometimes don't even use the word massage. We like to use the word nurturing touch or positive touch communication. The touch should always be pleasant for the baby. We find that using gentle but firm strokes usually calms the baby down. The slower we do the massage, the more relaxing it is for the baby as well. It is possible, like Julia said, to also do the massage over the clothes, because sometimes the babies are so sensitive to touch that they cannot tolerate to have the skin-on-skin touch right away or the strokes right away. In that case, we will also teach parents techniques that we call resting hands or containment holds, first just touching the baby before even starting with strokes. And it can also be that the baby is sensitive to the product that we use. If we have skin-on-skin touch, of course we have to have an oil or something that we massage with to lubricate. And if the baby is sensitive to oil or does not like the feeling of the oil, we would recommend to the parent to use a different product.
One last aspect of the sense of touch, that we tend to think of touch on the body and the skin, but the mouth is equally important. And so when we're working with a child who's very tactile, defensive around the mouth, it's very common for 5, 6, 7-year-olds, for parents to say they'll only eat mash and bananas and chippies and so on. That speaks to a sensitivity in the mouth around different textures. And there are whole programs that we can do to introduce different senses of touch and textures to the mouth. So just to keep into consideration, the tongue, the lips are all part of the sense of touch. And if the sooner we can get in with a very young child and develop that sense in a healthy way, the healthier it will be for the child going forward.